3680.
There we go. Why didn't that start automatically? I love a good setup. All right, so one more thing that's not starting on its own. This is crazy. Ready? Here we go. There it is. What is with this?
Well, it just keeps you on your toes.
Always.
I mean, if it weren't for the union, our engineer would be yelling at you right now.
I know, right? Where's my gaffer? No, not fluffer.
Hey, I was waiting because, after all, there's a union for them too.
All right, welcome to Stages of Life Radio. Text line's wide open, 23680. That's the number, 23680. Already got texts coming in with questions, and
Excellent.
Today we're going to talk about what to do and how to build up your immunity if you get the COVID, right?
Yeah, well,
Okay.
one of the things that you have to have on hand just in case. Okay, because a tremendous amount of my time is being devoted, unfairly actually, to answering people's telephone inquiries. Well, what were those things you said on the air? Because like I need to be writing all this stuff down.
Yeah.
And in fact, I have, but where do you go to get it? So it takes just about as long to go ahead and get people lined up one by one than it's going to be what I'm going to try to accomplish this afternoon. Mm-hmm. So there are 6 things that you need to have on hand just in case you get COVID.
What?
Very simple. 6 things. These are of a nutritional nature. Now, of course, if I were you, I'd be getting 3 other things. I'd be getting a pulse oximeter for about $10 if you buy it on eBay right about now. The second thing would be a blood pressure cuff. They cost about $35 at Walgreens, CVS, Target, or wherever you choose to get it, with fresh batteries, of course. And the third thing is an ear temperature probe. Those 3 things ought to be in your medicine cabinet or
Okay.
in your locker, whatever it is that you call it these days. You can't find a medicine chest anymore. But these are the things that ought to be under your sink in any event. Why? Because if it's not this illness, it'll be another.
Yeah.
So have it. It's a good thing to have around. But that's not what this is all about. But there are 6 things that I want you to have on hand in case you get sick. There's several of these that we'll talk about later if I have enough time that you ought to be taking whether you get COVID or not.
Okay.
The first one is an oddball to most people. It's called licorice root extract. Now, this is not the same thing as anise liqueur, which, by the way, is always marvelous after a fine steak.
Love it.
But licorice root extract contains something called glyceric acid. Glyceric acid is an antiviral, and just because you're sick with down ill, doesn't mean that there's nothing you can do about it, or you need a Z-Pack from somebody. God knows why. Zithromycin is going to help you with the virus, because it doesn't. It makes you sicker, a lot sicker in some cases. But licorice root contains glyceric acid, which is an antiviral effective against COVID, as well as rhinovirus, adenovirus, influenza, parainfluenza, and a bunch of other viruses. And it's cheap. It has its problems. It has its caveats. It has things about it that you need to understand. One of which is if you take too much of it, it can raise your blood pressure. That's not always a problem.
Yeah, but that's not always good.
Too much is too much. So you take the right amount, which means you follow instructions to the letter. It's the way that it works. Deglycerized licorice, DGL, is exactly the wrong thing. That's like getting a blank. If you're going to go hunting, don't go with blanks. It doesn't really help you very much. But that would be a blank. But licorice root extract also gives you a bump of energy, which is very useful when you're down with the illness. Okay? Down with the illness. All right. So licorice root extract. Very, very inexpensive, but it's also something that's helpful for nausea, believe it or not. In South America, they call them digestives. So if you're a little upset stomach, a little bit of licorice is very, very helpful. So licorice root extract. The second one, and this is wickedly cool stuff, and it's called lactoferrin containing colostrum. And you're going to go, okay, eyes glazed over. Don't. The lactoferrins that are in lactoferrin containing colostrum are every bit as effective against COVID as remdesivir. Now, I've got a really cool article on this that was sent to me by a good friend of mine who's also a sponsor, pharmacy specialist. I was working with him and something else, and he sent this to me. He said, well, do you still have that lactoferrin containing colostrum? So, yeah. So he sends me this article looking at the MAC, which is the effective concentration of lactoferrins, and it was actually more potent than the remdesivir. and it's like $30 a month. It's very, very cheap. Is it something you want to have on hand in case you get sick? And the answer is absolutely. Why? Because you don't want to be hanging out in tents with people, getting infusions of the monoclonal antibodies, because you really don't know too much about that. By the way, it's not FDA cleared either. It's under an EUA. So if you're not getting the shot because that's available, then you're a hypocrite. At least you know it. Third, N-acetyl cysteine, sometimes known as just acetyl cysteine. What does this do? Well, if you come down with COVID, if you come down with influenza, if you come down with any of these upper respiratory tract infections, acetyl cysteine helps you clear the mucus, which, by the way, is a big problem with COVID. People develop pneumonia and they die. Kind of sucks, but that's what happens. But acetyl cysteine also is thought to be preventive for COVID, and we're going to come back to that in just a second. And it's also quite therapeutic as an antiviral and as a gram-negative antibiotic. Acetyl cysteine, NAC, neat stuff. Guaifenesin, number 4. Okay, sometimes known as brand name Mucinex. We use one called Mucus Relief because it costs about a third, and it's the generic guaifenesin. What does it do? It helps clear those same secretions. It works with the N-acetyl cysteine to thin out the secretions and make you feel a whole lot better. It's neat stuff. But it's also a muscle relaxant, believe it or not. It was first developed as a muscle relaxant, but it's really used chiefly in this manner. Then the last 2 things. One's called Down to Basics Without Iron, specifically without iron. Now, why? Because, well, after all, you're supposed to go out and get zinc. Okay, let's understand. There are about 12 different minerals you need to go to get, and zinc is only one of them. Why they chose that one, estrogen receptor blocker. It's marvelous stuff, but it helps the immune system in one way. If you're vitamin D deficient, guess what? Your immune system doesn't work so well. So 40% of the Now, if you didn't get that down, okay, kind of am. We have a whole kit that we put together on this. What this does is allows me to see my patients during the day without having to answer the phone. And so this kit, okay, all these pieces together is about $152. We have it on sale for $137, and there's no postage involved with this. So if you call my office, we're going to put this all together. There's going to be a sheet of paper that goes with it to give you the instructions as to how this works, how you take the medications, and what you want to do. The last piece of it is that there are a couple pieces in here that you may want to take on a regular basis. The vitamin D you want to take every day, the Down to Basics you want to take every day, and oddly enough, the N-acetyl cysteine. Those 3 things you're going to want to take regardless. Why? The NAC helps with sinuses. Yeah. Show me a Floridian that doesn't have sinus issues. Show me a guy that doesn't have prostate issues. Pancreatic, biliary, hepatitis, a whole bunch of things. But NAC seems to be helpful for all manners of problems. So one way or the other, you're going to need these things. We have them as a big group. There's a discount on it and an instruction sheet from the doc. Mm-hmm. Now, let's open the lines up.
Oh, you want to open up the lines?
Sure, why not? I'm in the mood.
All right. Well, first of all, we've got, 407-422-1212. Got a bunch of texts here at 23680. I think we'll have time to get one in here. Let's talk about this 13-month-old with the second ear infection in 2 months and second course of antibiotics. Ear infections in little ones.
It's a real problem.
It's a real problem.
Now, you want to talk about an interesting thing with is it approved by the FDA? I don't know of very many antibiotics that are approved for use with infants. Okay, but yet we do it all the time. Why? Because we don't need the FDA to teach us how to treat patients. So do you treat little kids with antibiotics? Yes, and we're going to come back to this in a moment because this has a few lessons attached to it.
It does.
After these words from our sponsors.
Yep. So you're listening to Stages of Life Radio. We do this Sunday afternoons, 4 o'clock until 5, because somebody has to. Seriously.
Well, really. I mean it's either that or you'll be listening to the financial guys.
Yeah, financial guys. Or
doesn't that make your eyes glaze over? It's kind of like, you're going to die broke.
Yeah, a lot. Only because I do.
I mean, I go to sleep sometimes thinking, I'm going to go to die broke.
I'm going to wake up broke.
Uh-huh.
They make you feel good. Stay right there at Stages of Life Radio. All right, everything went to crap here. All of a sudden, Linda starts calling me because she's not here. I'm not here. Well,
I didn't see your car out there.
Nope. Me neither. She's on her way. She's like, it's 4 already? Yeah, it's 4. What's wrong with you?
Time to go to school.
Yeah, everything died out on me here, too.
Low battery.
Yeah, I know. That's source. Come on, baby. We are here. Look, there's a green spot. I'm working on it.
It's like a green screen.
Mm-hmm. It is a green screen, just a little bit of a green screen. But everything went to crap.
Okay, now, for our Facebook listeners, okay, now, I was enlightened to a bit of, let's just say, a little bit of toxicology, odd toxicology this past week. Okay. Now, locally, so here in Florida, I think Alabama, and oddly enough, Virginia, 3 states have reported these particular caterpillars to be present, which means it's present in all of them, but people don't know what it is. It's a thing called a puss, P-O-S-S caterpillar.
Puss caterpillar?
Oh, yeah. Oh no. This sounds like an just an innocuous little creature. And when you look at it, it kind of looks like your neighbor's cat. Don't touch it. Okay, don't touch it. It is one of the most painful toxins that you can receive from the animal kingdom. It comes from this particular caterpillar, and it will make a believer of it. It's probably more painful than giving childbirth or passing a kidney stone. And there's nothing you can do about it.
Zach, we're gonna be back. I'm still trying to get these cameras working back again, my friends. We are here, though. I know, it's a beautiful view. What is happening? This is because Butthead called in. I love you, Butthead, but yeah, we're also early here, like a few seconds. So we'll just talk for a second here while I try to figure out what the hell happened. Welcome back to Stages of Life Radio. Melissa Fox along with Dr. David Klein. What do you got? Don't forget the Heart and Soul with D3. Wow, these people are on top of it. 23680. Give us a holler on the text line if you have some questions. Give us as much information as you can. Now, when we went to break, did you actually answer the earache?
Not entirely. Yeah. Oh, no. I've still got a moment or two left for her.
Okay, we had a text here. We left before the break. 13-month-old, second ear infection in 2 months and a second course of antibiotics, and we were making suggestions.
Yeah, well, the first thing you need to look at, okay, ear infections in neonates or children of that age, really not all that uncommon. But, you want to make sure that the kid is not doesn't have allergy issues, which can cause the tonsils to swell and thereby cause the ears to get infected by putting pressure on the eustachian tubes. Kind of a neat problem. What you're really more interested in, what the heck do I do about it when the kid gets an ear infection?
Yeah, it's horrible.
So it's horrible. Oh, the kid starts screaming, you carry on. It is bad news. What I typically ask people to do, and this is a very simple thing, is to use mineral oil. Now, mineral oil, or if you're from the South, mineral oil.
Mineral.
You know what I mean? It's about $2, $3 at the local pharmacy. And you take a piece of cotton, just a tiny piece of cotton, which might be about the size of, let's say, your thumb, okay? Because if it's too small, it'll get stuck in the kid's ear. So small, but not too thumb, really not any smaller than your elbow.
Gotcha.
And you put a drop of oil in the child's ear, a little bit of cotton, and then you put a washcloth or a towel over it just to kind of keep it in place. That oil will pass through there, and it'll start clearing out some of the debris that sometimes causes the ear infection. If you do that, sometimes that will prevent the need for the antibiotics. If the tonsils swell, the eustachian tubes close down, the ear starts to retract, and then it starts to become either infected or looking like it's going to get infected. Antibiotics are fairly commonly used, and sometimes they're inevitable. But from your perspective, try the oil first because it'll prevent an awful lot of these infections.
Now, Lisa, who's watching us on our Facebook Live feed at Stages of Life Medical Institute, said garlic in olive oil worked with my kids.
Yeah, garlic is a natural antibiotic. Mm-hmm. So is olive leaf extract.
Yes.
Okay, so you can do that as well. But trying to get kids, especially a kid that's 1 year old, to do that's going to be tough. Garlic is tough even for most adults. Yeah. Garlic capsules, maybe, but again, 13-month-old might be tough. Now, if you're able to get your 13-month-old, 12-month-old, 18-month-old to take a capsule, God bless you. You're going to have to teach me because I've got two grandkids in that age group, and they don't take much medication.
Okay, so Doc, you started out the show
Gladly.
telling us 6 things we need to have on hand.
Yes, sir. Ma'am. Yeah.
Whatever,
Sorry.
it happens. Someone texted in even before the show started, remember to have Doc talk about natural immunity.
Yeah. Oh, yeah.
Now,
Okay.
natural immunity to what? Are we talking about COVID? Because there's really no natural immunity per se, is that right?
Well, here's what happens. There is no natural immunity to COVID. So how do we get immunity to coronavirus in the animal kingdom? And it's through something called colostrum. So we're not the only ones that get, coronavirus. COVID is something that hits basically all mammals. So cattle get it, your dog and cattle get it. It's not uncommon for diarrhea in animals to be caused from COVID.
Oh.
It's a big problem. So how do cattle prevent their calves from getting COVID? And the answer is by giving them mother's milk. It contains lactoferrin, which in fact is, actually it's the gamma globulin component of it that helps with COVID antibodies. It's very, very interesting. That's the first thing. Second thing is once you're exposed to it, the T cells that you have will then become sensitized to that particular strain or that particular type of organism. So you will then have in your library someplace, the information necessary for you to generate more and more rapid responses with humoral immunity, sometimes known as gamma globulin. So how is it that people with AIDS get so sick then? Because their T cells die off, so their library gets burned. Okay, like the Great Library of Alexandria. They come in, burn it, and guess what? You lose the memory of ages. And then you don't do very well because you really need that 2 to 3 weeks that it saves you so that you don't die from infection. That's pretty much what it is. Why should anybody with AIDS die of infection? We have such marvelous antibiotics. And the answer is you have to have humoral immunity, otherwise you're going to die of infection. And that's a big problem here. So natural immunity to COVID lasts about 90 days. And I've been researching this in my laboratory for the past 1.25 years. We measure how much you've got after inoculation, what type of inoculation, whether you've had it yourself, whether you got it naturally, whether you got COVID unnaturally. There are lots of ways to do that, by the way. And we're watching how these antibody levels go. They degrade, they disappear, they wear off. Somewhere between as little as 60 days, although that's unusual, 90 days, fairly typical, 180 days if you are lucky, okay, and we have 1 or 2 people that went 180 days. So what does this mean? This means that natural immunity is not so natural. When you go and you have a kid, let's say in elementary school, okay, they come home with colds all the time. And in fact, they keep getting the same cold. And have you ever wondered why that is? The same cold gets tossed around a class because you only keep 90 days worth of immunity to it. Now, you could easily say, well, these are different viruses. Oh, there are. Adenovirus, rhinovirus, influenza, parainfluenza, coronavirus, RSV, lots of viruses. But you'll catch the same common colds over and over again. And how do you know which one it is, right? You don't, but I do. Okay, aha. How would you figure out what the virus is? Through something called a DNA RNA PCR. And what you can do easily enough, if you're so interested, okay, and I quantify this. If you're so interested, you take a little bit of the nasal secretions. You do not need to ram this thing up somebody's nasal canal, especially a kid. You can, it's fun, but you don't have to. You just, if they can blow their nose, it's very easy to get the secretions that you need, and you run it through the PCR. And in my office, we can speciate 21 different viruses.
Wow.
Now, the problem with it is insurance doesn't pay for it.
Yeah.
Okay, so what do you know? Very few people ask for it. They go, I want to know which one it is. Well, it's $480. No, I don't really know. I don't want that much. So, and I get it. There's, everybody's curious with somebody else's resources. So, but we do this when we're looking for certain types of illnesses. Especially if you've got somebody with COPD, somebody with cancer, you've got to know what you're dealing with. Mm-hmm. So it's mostly the elderly that we do this for, but kids, we could do it. Do I think it's a wise use of resources? No. I'd say, why don't you take that money and put it towards his or her college education? By the time they get old enough, it'll still be unaffordable. All right, what's our next?
I got one here. Robert's online. He says, I have Care Plus. I take Eliquis and Entresto
yes.
twice a day for my heart. Cost me $300 $300 a copay per month. I'm on Social Security. Is there any other medication I can take that will replace these drugs for less money?
Oh, yeah, there are lots of them. I mean, you could be very easily on Coumadin, okay, which is much, much cheaper, except you'll be getting your blood drawn every week. You're going to have all kinds of other hassles, and by the time it's all said and done, it'll cost you more than $300, and it's much less convenient. Not to say that actually the combination that you're on is likely to save your life, whereas the Coumadin is likely to cost you your life at some point.
Can I decipher what you said?
$300
Not
is
bad.
a bargain. Okay, if they weren't paying for some healthy slug of that stuff, it'd be a little closer to $2,000 a month.
Exactly.
So count your
Problem is
blessings
fixed
on that one. No, I understand fixed income. I also understand, the need to save money when you're young, because this does become a problem.
Yeah.
But again, if you want to get buried next to Marilyn Monroe, it's going to cost you $2 million. And
Dude,
I don't care.
why?
Why?
Why? I don't understand what's up with you guys getting, with the tomb opening up.
Well, I
there.
was thinking about it. If I'd worked harder, I could be buried next to Marilyn Monroe.
I understand.
Although, in any event, be that as it may, I understand your concern. But if you need to do what you need to do to pay for your medications, you've got to do what you've got to do. Okay, that sometimes means work. I mean, I'm 67. I'm still
Here's the
working.
thing: these places are out there unless you're absolutely, totally, physically invalid, can't make it anywhere. They're
Yeah.
places that will stand you up and pay you just to come.
Yeah.
Every place you drive past is hiring here in Florida. It's ridiculous.
Yeah, and it's you can hang around at some place and work as a Walmart greeter, or you can hang around at home. What's it going to be?
Yeah.
Me, I've already retired twice, okay, and went back to work because I couldn't stand staying at home and doing nothing.
Same with radio. I did that 10
Yeah.
years, and I was like, I must go back. So,
Exactly.
here, what's fight cancer vitamins? D2 or D3?
D3. D2 is a pro-hormone. It really doesn't do squat. That's what's frequently what's given to you as a prescription because it's a patentable product.
Mm-hmm.
So D2 has to be converted to D3 before it works. D3 is cheap. We have a really good one in olive oil at $6 a month.
Mm-hmm.
So D2, you don't need a prescription, don't need you just don't need it, but D3 is what you want. Next question.
407-422-1212, 422-1212, or you can text in, which is always easier, 23680. Again, text line 23680. Ask the questions, give us enough information to try to help you out. Can you explain ADE, and is that affecting durability of the vaccine?
I'm not sure what ADE stands
I
for.
have no idea what that means.
Yeah.
Could you give us some more information?
Yeah, go ahead and define your definition. Send it back in. Let me get a look.
Let's understand a little better.
Yeah.
Yeah, that makes sense. So the natural immunity thing, that went south on that texture, didn't it?
Yeah,
Because
well,
you can't have a natural immunity, something you can get.
Yeah, exactly. So either there's only two ways out of this problem that we have right now. This pandemic, soon to be called an endemic. You got to love it. If you can't beat it, then rename it.
Pandemic to
right?
endemic.
Well, it's epidemic, pandemic. Now it's endemic. Endemic just simply means it's here to stay, which, by the way, is not a surprise. We're still testing for SARS-1. Okay, SARS-1, which is 10 years ago, it still comes and it still goes.
Yeah.
So what does this mean? It means that you're not going to maintain immunity for very long. Now, understand this, and this is very, very important. This is the take-home message of the day, which, by the way, you're going to have to wait until you hear these announcements first.
Yeah, we'll
Time that
give you
better,
that
would you?
take-home message, and hopefully he remembers it. You got
That's the
something to
key,
write it
yeah.
down?
Well, yeah, well, actually I don't, but
Write down that take-home message, or we will forget. All right, here's the deal. Support our sponsors. Pharmacy Specialists in Maitland, a compounding pharmacy the doc has worked with for several decades. They are awesome. You should check them out. Go to makerx.com. We will be right back. By the way, any products that we've referenced today can be found at stagesoflifevitamins.com. So simple, a child can do it. That was meant pushing the button.
that? Oh, okay. Well, I was thinking about, so is putting a bobby pin in an electrical outlet. Yeah, that used to be a real big thing when I was a kid.
I never know why.
Yeah, I don't know. The kids don't do it anymore. They're not curious, is what
I'm
it
not
is.
curious.
Yeah, they're too busy playing with their telephones
By the
or
way,
something else.
Karen suggested to Robert that he check with his doctor to call the manufacturer and maybe get some help with the medications.
Oh, there's that. Okay,
Yeah.
they
There's
always
always that.
have that. Second thing is sometimes you can send your prescription to Canada and make a break on it. That can work. Now
gotta
you
be
do run a
careful.
risk that it may be a phony medication. That can happen. Most of these things are made in India anyway, so it doesn't make that much difference actually. But that's That's how you do it. Now, each of the companies, the major companies, have patient assistance programs. So, and even for inexpensive medications, they do it. So it's not just Eliquis.
The problem is that a lot of them only last like a 6 month where they give it to you for free.
6 months is better than a sharp stick in the eye.
Sure. Plus, it also 6 months times 300. That'll take you down a minute.
Right. Well, what about like the Aimovig that my wife is on? So here as little as $25 a month, which worked out very well. What they don't tell you is it's only up to a point, which is usually 7 months now. So the last 5 months, it's $800 a month.
Right.
So that's $4,000.
That's how they get you.
That's how they get you. It feels good not to have a headache, doesn't it? So it's actually worth the $800. One visit to the emergency room will cost you 5 times that or more. So what have we got here? 80 is antibody dependent enhancement. I'm not sure what they're enhancing. Don't know. So Lisa, you may need to be a little bit more. I'd say a little bit more specific. All righty. Now that we're listening to Copacabana.
Hey, there's nothing wrong with the Copacabana.
Because it's always in fashion.
Always in fashion. Hey, it's our turn again. Look at that. Stages of Life Radio from 4 until 5 p.m. Eastern Time on the East Coast of, whatever. We have a lot of questions. We got a gentleman on the horn here. I should probably get to that. I've already forgotten his name. But before, we got to do the takeaway.
Yeah, and then Lisa, I'm going to come back to yours in just a sec because I think I know what the question is. All right, so what we're looking at really can be more seen as long-term immunity. So once you've had the T cells tickled, once you get this into your locker, your memory locker, then it only takes a short period of time, sometimes 3 weeks, 4 weeks, sometimes less, in order to get the antibodies racked up. So the people that are getting sick a second time, a third time, or a fourth time with COVID, which, by the way, is happening right now, in this town.
It's not a breakthrough case.
It's not breakthrough. The symptoms aren't very severe because your body is kicking out antibodies before you have a chance to go completely nuts. So who is really getting ill the second time? Those individuals that don't have T-cell immunity. People with AIDS, folks that are on chemotherapy, and those individuals that are taking medications similar to chemo agents, like if you have rheumatoid arthritis, lupus and whatnot, and you're taking alkylating agents. So now, with regards to antibody-dependent enhancement, what I have noticed in just my simple country doctor laboratory is that when individuals get the virus and then they receive the vaccine, their antibody levels go through the roof. Now, we've been quantifying these antibodies since, I guess, October of last year.
Yeah.
So it's been a long time. And what we're finding is that the variability in response can be anywhere from 2 or 3 IUs per ml, which doesn't mean anything to anybody, to as high as 70. What does matter, IU, well, I haven't really defined the units yet, IU. So that's what we do. When you don't have anything else, you call it an IU. Okay. All right? Because it's not nanograms per deciliter, picoliters per milliliter. It does none of that stuff. No, none of it. So what you do is you just simply look at a scalar number. You have to give it a unit, so we call them IUs. So, my particular situation, I got the vaccine almost 2 days after I got sick. So I had both the vaccine, the Moderna, and the illness at the same time. My levels went up into the 60s. My wife, who got the disease at exactly the same time but didn't get the vaccine until 6 weeks later, made it all the way up to 20. So what's the deal? They tell you not to get the vaccine if you're sick because you might have a healthy, heavy reaction to it. It might be dangerous. That's not true of any other illness now, is it? Now, there's one reason why I would tell you not to go to the inoculation stations if you're actively ill. And the answer is because you don't want to give it to people. It has nothing to do with it making yourself any sicker. That's nonsense. Okay? They don't check you for antibodies to see if you're ill before you get the vaccine, now do they? They don't. Nobody's really checking to see if anybody is sick at the time that they get the antibody or the vaccine. So I think that's utter absolute nonsense. The thing that bothers me most about the way this has all been handled is the general distrust that we all seem to be developing towards that which we hear from the government. Now, is it concerted that they think that we're too stupid to understand?
Probably.
More than likely, that's the answer.
I think that's the answer.
Do they not want to scare us? Nothing's scarier than finding out you've been given misinformation.
Right.
And then the other problem is that some of the stuff they're saying is very, very true, and much of it isn't. But it's up to you to figure out which it is. That leads to bad decision making. Really bad decision making.
Hey, are you there?
We have a caller. I was wondering what you're bouncing around the floor.
I'm just messing with the phone. Hi there. You're on Stages of Life Radio. Don't swear. They can't hear us. They're there for sure. Oh well. All right, I'll just hang up.
Yeah, remember Radio Shack? They went out of business. Well, the problem is that we're trying to return some of the equipment.
Oh, I got it. Okay. Looks like they're.
We'll try this again.
All right, let's try again. Maybe not.
Yeah, much of the equipment that we use, oddly enough, is very similar to the stuff around your house. It's made in China. And they brought us the Chinese drywall,
Jay, are
those
you there?
couplings that caused the leaks behind the walls, and bad chips.
Hold on. Jay wanted to know about an alternative for taking Crestor at 5 milligrams.
Sure. Okay. Why would you pick Crestor as a statin in particular? Okay. Why? It's more expensive than the rest of them. But what it does is it knocks down triglycerides more than cholesterol. So what you do is you tend to use this medication if somebody has elevated triglycerides. How do you lower triglycerides naturally? The easiest and most consistent way to do it is to use something called berberine. Now, berberine is way neat stuff. It lowers insulin, lowers blood sugar, which in turn lower triglycerides. So it's not directly lowering the triglycerides. It's indirectly doing it by making your cells more insulin dependent, okay, or more, let's just say receptive, better word.
Okay.
Now, what else can do it? Olive leaf extract can do it, not olive leaf or olive oil, but olive leaf extract can do it. Inositol can do it, but berberine is really your best bet.
Very good. There you go, Jay. There's your answer to that question. Sorry.
So we couldn't get him on the phone.
Figure
but
out
we'll
how to use a damn phone today.
Yeah.
No, it's my fault. Anyway.
So we're not going to blame Spectrum or anybody else.
No,
not today.
I could. I mean, that's always a good catch-all.
No, I know everybody can appreciate that.
right?
That's like blaming Microsoft or Facebook or whatever. I mean, you got to blame
Great
somebody.
answer. So we had a texter here, 23680, again, text line. You just mentioned that vitamin D is an estrogen receptor blocker.
That's correct.
I am on estradiol patches. Would that interfere with my hormone therapy?
No. Okay. What you're looking for, okay, vitamin D3 is helpful in individuals that may be estrogen dominant. So you're receiving an estradiol patch, which is not one of my favorite ways of doing it, although I do have to use patches periodically. But no, it shouldn't bother at all. You have 3 different estrogens to block: estriol, estrone, and estradiol. As long as you're taking enough estradiol on board, you should be okay. The levels ought to be checked about every 90 days, whether you're taking it orally, whether you're taking it as a patch or through cream, transdermal. If you're taking the pellets, God help you. All right. And so what do? You need to make sure that your estradiol level is between 30 and 50, 30 and 70, in that range. Otherwise, you start getting yourself into trouble. So I will use vitamin D3 to treat, let's say, PMS.
All right.
I'll use it to treat estrogen dominance, but it's also very, very helpful in that it reduces your risk of all cancers by 50%. It's kind of cool.
Wow,
and MS
lot.
by 40%.
A lot of questions coming in here on the text line and on our
At least it's not on the phone. Man, that phone's a real bummer.
The phone's okay. I mean, it's operator error, I'm pretty sure. I won't blame the operator. When was the last time you saw one of them? I have had a cold for about 1.5 years now, a cough, excuse me. Been to the ENT, been to a cardiologist, have occasional PVCs and occasional acid reflux, no conclusion. What could be causing this cough?
Okay, now, if the ENT is going to tell you it's coming from the acid reflux, because the acid's coming up and hitting the underside of your vocal cords, thereby causing that dry cough. The cardiologist is going to tell you something else. But what typically happens and what can cause a cough lasting longer than 6 weeks is pertussis, sometimes known as whooping cough. So there's pertussis and parapertussis. These are gram-positive rods. This is a bacterial infection that can sit in an indolent manner. What's interesting about this is it can also cause conduction irritability of the heart. So it may be causing the PVCs. So generally what I do is I start people on a 2-week course. Sometimes it translates into a 6-week course of a medication that costs a fortune called doxycycline. It has been around for decades and works very, very well for this. I did. Yeah. Doxycycline is just a marvelous medication for this. The folks up at Hopkins at one point about 15 years ago estimated that roughly 30% of people that have a cough lasting longer than 6 weeks have chronic undiagnosed pertussis.
So let's see. Is Rick actually on the phone? Can Rick hear us?
Yes.
Ah, see, Rick is there.
Hey, Rick, sorry for the delay there. We've been having some technical problems. I think it's because we couldn't figure out which switch to throw.
Shush, it's mostly not me. It was me. Okay, just call me out. So, Rick, you've got a couple of questions about COVID rumors, correct?
Yeah, there's three things. Two from talk show hosts on daytime radio who think they're doctors. First, masks don't work over and over and over and over again. And the second one is people who get vaccines and are more, for the virus, are more spreaders than the unvaccinated because they permit herd immunity. It was actually a doctor who said that, and that's crazy.
Yeah, well, that's and you know something, you're correct that not all doctors really have their fecal material together.
He said that about Delta.
Okay, about Delta? The Delta is really not any different than the rest of them.
It's just a guess.
It's just So what they're saying that it's more contagious. It probably isn't. I'm seeing in my office. I've been there every day since this whole thing started, and I was there for 40 years. I've been practicing medicine for 40 years longer than this pandemic has been around. And what I will tell you, okay, is that if it were all that contagious, a husband wife would get it together 100% of the time, and they don't. It might be more like a quarter of the time. Very, very frequent you're going to hear about a husband and wife that one gets it and one does not. And it's not because one has immunity and the other one doesn't. It's because one got it and the other one didn't. If this were as contagious as, let's just say, chickenpox, everybody in the family would get it. So that's the first thing. The second thing is with regards to it, that masks don't work. Viral particles are so small that they will pass through whether it's 1 or 10 masks without any resistance whatsoever. That's just the way that it is. Doctors wear masks in the operating room not to keep from getting sick from the patient, but to keep from drooling in the wound, okay, from spreading their disease to the open wound.
I knew that.
That's the way that it goes. Now, do I tell my patients to wear or not to wear a mask? I don't even really care. What it does is it reminds you to be careful. Mm-hmm. That's really what it boils down to. If you walk around wearing a mask, you're going to remember everything else. If you're not wearing a mask, you're going to tend to forget about it. The single most important thing to keep from getting sick, one, is be careful who you kiss, okay, because that's just the way it works. And the second thing, okay, is wash your hands.
Wash your damn hands.
Wash your hands. Don't touch your face. If you want to wear a mask, just knock yourself out. It's just fine. It is not going to hurt anybody. But are the folks that got the vaccine going to spread it to everybody else? No. No, the folks that are spreading it are the folks that are actually out there hanging out in bars, nightclubs, amusement parks and whatnot.
Well, some of us are hanging out in bars and nightclubs and not spreading it.
Well, that's true. You may have seen me there. Okay, I'm sure you've seen Melissa there. Okay, but the fact of the matter is that you're far more likely to get COVID from what you eat and drink, and not necessarily from droplet spread. So kids, you send your kids to elementary school. Okay, one of the smartest things they've done actually was turn off the water fountains. You turn off the water fountains. That's where you're going to get it.
We used to be called about trench mouth.
Oh, you could catch mono at those things all the time. So all of the problems you got from those water fountains, so they turned them off. So what do I think? That's pretty much what I think. The talking heads on TV, whether they're doctors or not, they're operating from scripts.
Yeah. By the way, Rick, you didn't have 3 questions.
Oh, yeah. What was the third one?
No, they really weren't questions. They were comments.
Oh, which is fine. What was the third comment?
I don't remember. I hung up.
Yeah.
I'm sorry.
Yeah.
407-422-1212. Got a few minutes left of the show so that you can have a call get through.
But you have to be careful about who you listen to. One of my favorite things about the talking heads is they are all promoting books. Okay, now let me give you a little clue. You can't see patients and spend hundreds of hours writing a good book.
Yeah, that's no way.
So that means either you're not seeing patients or it's not your book.
Which would it be?
Which might it be? Yeah. So in any event, either you're a clinician or you're not. And so you go ahead and see some pretty gal in her late 30s with a book behind her. Okay, and we've got a couple of those that are out there. Yeah. Odds of her actually seeing patients on a daily basis, as I do, are very, very small. Now, my friends up at Hopkins, when I used to work with those guys, they would work 6 weeks a year in the clinic, and the rest of the time they were in the lab or doing their research. That is not a lot of time to actually get to see patients. Now I'm going to give you a little piece of information that you're not going to hear from any of the talking heads. You're not going to hear it in the morning news. You're not necessarily going to hear it in the evening news, but you're going to hear it right now.
Do it.
One of the things that's hitting the intensive care units right now, and they're going to say they're mostly young people, wouldn't you know? Now, well, some of them have diabetes and a lot of them are fat. One of the things that's hitting is lots of them vape.
Yep.
Now, the vaping may be setting people up in the younger age groups to get these illnesses. So vaping is a big, big problem. And this was predicted a long time ago.
Lung and all that, 10 years.
Bad news. Okay, so if you're vaping, guess what?
You're
You don't find
yourself.
too many old people vaping.
I got Alma on the phone here.
Oh, here we go.
Hey, Alma. How are you? She's
Hi.
49, extremely dry skin in the palm of her right hand and also outside and to the point where it bleeds.
All right. So where's she? Okay, so you're there, Alma. When did this start?
This started, I want to say it's a year now.
How old are you?
I'm 49.
Okay, and so all of a sudden, one area on your hand started to develop, crustiness and dryness.
Yeah, I thought, it was the soap at work. It's pretty strong, but then I'm just wondering why is it only affecting the one hand? And I thought, okay, well, maybe it's the chemicals. Sometimes I use bleach in the wash water.
Okay,
I started wearing gloves.
Is it your right hand or your left hand?
Right.
Okay.
My right hand.
Are you right-handed?
I am right-handed.
What kind of work do you do?
I'm an educator.
Okay, and so you use bleach for what reason?
In the dishwater or,
At home.
yes, at home.
Oh, okay, fine. All right. So, if you're seeing these sorts of eruptions or if you're seeing these sorts of rashes on one hand, in particular if it's a dominant hand, very often it'll be as a result of breaking the skin either with an instrument of mass destruction like a pair of scissors, it could be a pair of pliers, could be a hammer, could be any number of things, and that can set you up for a fungal infection. And I've seen people develop these fungal infections in the palms of their hand, but it doesn't happen to educators as often as it does for folks that work in their gardens. So do you work in your garden very much?
No, not very much.
Okay,
I
yeah.
usually wear gloves when I go out there.
A
plant, I'll transplant, a plant.
Okay, yeah, because more than likely, okay, what you have there is a fungal infection. So I've had 2 patients in the past 2 years that developed unusual fungal infection called Sporothrix shankai. The chance of you having that is very, very small.
Grapefruit seed extract.
We're getting to treatment in a second. First thing
Hurry
is what it. Oh yeah, she's telling me that I don't have time now. Okay, what I'd like you to try. First things first, I want you to go ahead and use a topical antifungal called gynolotrimine. Why gynolotrimine? Because it's cheap. I like inexpensive treatments. And so you put the stuff over that area 3 or 4 times a day. Most important before you go to bed. Second most important is before you go to work in the morning. There's something else called gynolotrimine. Yeah, it's generally used by women to treat itch down below.
Yeah, it's one of those
vaginitis.
A yeast infection kind of stuff.
Okay, but it works well for this. The second thing you want to try is
Maybe that's why the AD ointment was helping, because I tried using that on my hand.
Yes, indeed.
That's it.
There you go. Second thing is oral grapefruit seed extract, so that way you treat it from the inside out. You can get that at Stages of Life. Yeah, stagesoflifevitamins.com.
Grape seed extract.
Yeah, marvelous stuff. Grapefruit seed extract.
Grapefruit seed extract.
Okay, and you get the capsules. So if you can use the gynolotrimine topically and the grapefruit seed extract capsules, you should do just fine. And be careful because you're breaking the skin. You just don't realize you're doing it.
Somehow we missed a break.
Yeah, I am. I get these cuts, and I'm like, and it's scary, especially now. I don't want my skin open.
Be careful, baby.
So.
Okay, this should be easy. And good luck to you. And let me know if that doesn't do the job. I'll be shocked if it doesn't fix it.
Right.
Okay. What? The capsules. I just followed instructions on the bottle.
No, you follow my instructions right now. You take 2 per day. 1 in the morning, 1 in the evening.
2 per day. Okay.
Yeah, and so they come in bottles of 90, which that means it'll last you 6 weeks. My advice is to get 2 bottles. That way you'll have enough for 3 months, which should be sufficient to get this under control.
Most definitely.
Okay.
All right. Thanks, Alma.
All right. You're welcome.
Oh, yeah. So, somehow I missed the commercial break there. Anyway, we're working on it right now. We're here. It's okay. Blah, 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 blah. All right, so we are back in a minute, and then we have like 5-6 minutes left to go because we weren't really long on that segment, and I don't know why. but it's okay. It all works out in the wash. Dr. Klein, did you get the booster yet? That's a question.
Have I?
Kendra.
Actually, I haven't needed it yet. But Kendra, thank you for looking out for me. Yeah, my level was 12. I typically ask people to get it when their levels drop below 2.5. So I'm making room for somebody else. My wife, on the other hand, needs to get it now, and so she's been having she got a little bit of pushback at the pharmacy. Why? Because she didn't see the regular pharmacist. They had some technician there that said, "Well, you're not on this list." I'm thinking, what the hell, So we'll send her out this week and grab it again. But no, I haven't had mine yet. She's getting hers.
Awesome. Okay, let's see. Do vape liquids contain propylene
glycol? They contain all kinds of different things.
They don't even know.
Okay, but it could be things. It could be vegetable oils.
Welcome back to Stages of Life Medical Institute. Wow, dry dominant hand. Really, text line. Dr. David Klein, how you doing there, Doc? We got just a handful of minutes left here because we went a little long in that last segment. There was just so much to cover. Do all vaccines carry DNA from poultry?
No. In fact, I don't know that any of them do.
Where is this coming from?
Well, I don't know. Somebody someplace is generating more and more rumors. So there should be actually a new cabinet position, which ought to be Department of Rumor Control.
Diffuser of disinformation.
Yeah. DNA of poultry? Why? Do you think that it'll make you chicken or something?
They're like, I think it's great. Should everyone take inositol or CoQ10?
I don't know that there's anything that everybody should take.
Yeah.
Okay, as a general, you need to, when you're taking things, you need to have a reason, a mission, a goal. So why would you take inositol? Inositol lowers cholesterol. Inositol lowers blood sugar. Inositol lowers insulin. Inositol is a natural antidepressant, and it also helps for people that are OCD or have substance control issues. So yeah, that encompasses a lot of people, but it doesn't mean that everybody should take it. Vitamin D3. 40% of the population is D3 dependent. It's a whole lot cheaper to treat that than it is to diagnose it, because it's actually cheaper to do it for 3 or 4 years than to run the diagnostic lab on it. So most everybody should do that if you're over the age of 25. Okay. So there are some things that everybody, I believe, should do, but I don't think there's anything out there that everybody must do.
Yeah, I mean, that's pretty direct. Tendra said thank you, by the way. Do the vaccines have graphene oxide in them?
No.
Lipid.
Oh, this is another one. Okay, graphene is a black substance. Okay, it's like graphite. Graphene is another really, really cool rumor that's out there. Well, they're putting graphene in there and it's going to kill you in 3 years. Graphene would make the vaccine turn gray at best, black more than likely. So if you look at that liquid that they're injecting you with, okay, look at the bottle, it's clear. If there were any graphene in that, it would be gray or black. That's just the way that it goes. So the answer is negatory Batman. That's just one of those things that does not make any sense at all.
No, it really doesn't.
Graphene. I had somebody tell me, "Oh, you're wrong." I said, "I'm not wrong." I looked at it. Graphene is black. I'm sorry. Just the smallest amount of graphene will turn a clear liquid into a dark liquid. You would, and the people that are giving you the inoculations look at it. It looks clear. Means it doesn't necessarily have anything goofy in it. So really, get the darn vaccine. Stop looking for excuses not to do it.
Trying to find a reason.
Soldier up.
They
Just
really
do
are.
it.
They're just trying to find reasons.
If you want a reason not to get it, just say, "I don't want to do it. I'm chicken. I'm a coward."
You're chicken. Why are you starting the music already? It's not time. Oh, man.
Dance.
I know, right? Goodbye to you. Not quite yet. Give us another 30 seconds. Guys, it's been really interesting. Lots of interesting questions today.
Oh, I love it like that.
Yeah.
If we were doing the same thing every day, I would get bored. So
Yeah.
and no, we take every call in order, unless somebody has something really, really,
Yeah, something crazy.
Something people are just really crazy.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434.
And that's it?
I didn't even know she was here.
I know, she just showed up.
That's 407-679-3337. Dr. Klein accepts many insurances and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.
We ended the show early after all that. Hey, all right, guys, we're out of here for this week. I'll catch you on Good Morning Orlando tomorrow, 6 a.m. Dr. Klein will What?
And I'll be there Tuesday morning, too, at 7:10.
Oh, you'll be there on Tuesday. Okay, there you go. So you've got your week all planned out for you. More Klein all the time, right? And I am now the diffuser of disinformation. That's my new title.
I like it.
You like it? That's a good one. All right, guys, you have yourself a wonderful rest of the weekend, what's left of it. And Doc?
Adios.
Be well.
Peace be with you. Pax vobiscum. God love it.
Radio station, we pay the